Hello, we're going to be talking about culturally aware patient care. So, what is cultural awareness? There are so many different cultures here in the US, and each person responds differently to treatment and especially in healthcare according to their culture. So, cultural awareness is the ability to perceive cultural beliefs, values, and customs and understand how they shape our decisions and behavior. It's really key for us as healthcare professionals to do this for our patients. So how can we implement culturally aware patient care? It requires for us to stay back and try to understand their perspective. And there's 5 ways that we can do that, and we're gonna be talking about that through this presentation. The first one is overcoming the language barrier. In the US, there are so many different languages and many people don't speak English. So it's really important that these people actually know what the treatment they're receiving and what's going on with them. So there are 3 ways that we can overcome the language barrier. The first one is for us to get certified and train a different language. The second is many hospitals actually hire medical interpreters so the people can receive the message. And then three, this is so important. We as nurses, we need to make sure that the people understand what's going on with them and the treatment they're gonna be receiving. And that's our responsibility.
Okay, so when we need to learn about other cultures, I just shared some tips over there. Basically seeing what our majority of cultures are, what they're afraid of, and what their dietary choices are when they are being when they have been after surgery or after they have had different procedures. This will help us to be their advocates and also show them that we care about them. And with that, we will have better results. They will be sticking to their medications or maybe involving in therapies for a longer time or right after they have been in surgery.
So religion usually takes a very large role in people's lives. And so we need to understand and respect those beliefs. Some religions actually prohibit certain procedures. So a great example of this is the Jehovah's Witnesses, who usually come with a paper that shows the procedures that they will or will not participate in. One of these would be donating or receiving blood, and they believe on that based on these scriptures. So I think it's important to learn about religions and exactly why they believe these things and why they make certain decisions. And then it's our job to make sure the patient knows the risks of making those medical decisions, so they can know for themselves that they are making a good decision.
Health literacy, as defined by the CDC, is the ability of oneself to find, understand, and use information to make well-informed health decisions for themselves or for others. And in certain cultures, there are varying degrees of health literacy. So there's people who are gonna know how to take care of themselves and others who are not. And so it's an important part of being a nurse to teach people how to do that. And there are 3 ways in which we can do that. The first being to explain the medical procedure in great detail. The second being teaching patients how to continue treatment at their home when they're away from the hospital, because they're not going to be there forever. And lastly, and probably most importantly, is to ask patients to confirm their understanding of the procedures taking place. As previously mentioned, if the patient doesn't understand what's going on, then it's going to be really hard to know how to care for them, and it's a danger to them.
Patients may have different beliefs or requirements due to their religion, culture, socioeconomic status, or sexual orientation. As nurses, we can try to educate ourselves about many common practices. However, it's also okay to ask if there are any cultural or religious practices or beliefs that you need to know about in order to respect and support their needs. Educate yourself about the common cultural practices in the area you serve. Pay attention to common religious beliefs, values, and ethnicities. Understand how culture influences healthcare and establish a plan for the best care, taking into consideration the concerns and practices of the patient. Your open attitude towards differences and genuine concern for the patient can improve the healthcare outcome. As nurses, it's important to provide a high standard of care for all patients. We can do this by being educated and aware of different cultures and their practices.